And when we talk about the uncertainty surrounding the stock market based on COVID, when we talk about the uncertainty of this election, frankly, based on COVID, it seems to be the issue that's captured the most amount of attention when it comes to how people are deciding who to vote for. We're looking at the number of residents in DFW who've been exposed to COVID, and you would think with the numbers as high as they have been for as long as they were high, and now they're spiking again, that a fair large percentage of people would have been exposed to COVID. Scientists are saying, Jenny, 5%, just 5% of people have been exposed to COVID-19.
Well, we have a big population here in the Metroplex, don't we? I mean, the truth is we have millions of people.
Right.
And so as much as, you know, I know, gosh, tragically, several people who have lost their lives to this. I know a lot of people who have had it and have gone on and had no symptoms. You and I have both been exposed multiple times.
I know, that's why this number seems... Because
So it's a little shocking.
It is shocking to me because you and I both know so many people who've either had it, been exposed to it, that I wonder if this number is accurate or how they're deriving the number. It's below the national average, which, by the way, is 9%. Generally speaking, 9% of the population on average has been exposed to it. This idea of herd immunity, that in order for the virus to go away, a certain large percentage of the population needs to be exposed to it. That's 60 to 70%. We're a long way from that. And by the time that number of people perhaps would be exposed to COVID, would we have a vaccine? We also know, and science seems to bear it out as well, that there's some uncertainty around how long you're actually immune to it once you have immunity. Is it 3 months? Is it 4 months? And there are cases where people have gotten it a second time and been sicker the second time around.
So what they have is this survey of 44,000 participants filling out these surveys and doing antibody tests and such. So that's how these things are being figured out, because the truth is, I mean, if we're just like getting real on this, we don't know how many people have been exposed. You might have been exposed at the grocery store. You do not know. That person who didn't wear a mask that day could be the person who gets it and they don't tell, or they don't participate in contact tracing. Or God forbid, they're very sick and not able to participate in contact tracing and say, you know, let everybody know. So the truth is, we don't know it all, but it does sound like Dallas does not have as much exposure as everybody else, which is really, really shocking.
And yet among that 5%, there is definitely a division among socioeconomic groups.
Of course.
Ethnic groups as well. For example, 51% of those hospitalized have been Latino, compared to 17% among those hospitalized are white. And we also know that critical infrastructure workers make up the vast majority of those who've been exposed. That includes frontline workers who have been right there in the hospital from the very beginning.